Good evening. I'm Soledad, speech language pathologist. You know who I am if you're here today, so you already know what I'm about. Thank you so much for being here today. I'm excited to be able to share. You have no idea what it means for me to present. It means to share with people what my insights, the things that I've learned that were better. And so today is one of my last webinars of the summer. Hopefully there'll be more in the fall, but I just want to share with you something that's really, really important. And I realize in retrospect that maybe I should have started the summer with it, but that's okay. Here we are. We're talking about it. So let me just share my slides, and I'd like to know if somebody can tell me if they can see my slides. Hold on a second, share. And then I'm going to share over here. Okay, so I am going to move down to the agenda and come back up. I just want to know from somebody in the chat if you could see the agenda. Yes, you can see. Perfect. Thank you. So I see some people here from a little bit from everywhere. So thank you so much for being here. So today, managing difficult conversation, and acing conflict resolution. This is a big one, guys. This is like life lesson. But we have to understand that we have to talk about it because as clinicians, or even as students, as new grad, as seasoned SLPs or clinician or curious clinician, we always need to interact with other people. And sometimes it gets tense. And I just want to tackle it. I think it's a big one that we don't really talk about in school, but this is something we should really talk about now. Notice that on my slides, I always put the butterfly. This is my little reminder that the hour that we spent together today may have a huge effect in your professional, personal life later on. You know, the butterfly effect where they bat their wings in one area of the world, it creates a storm in another part of the world. I'm not trying to create a storm negatively. I'm trying to create a big impact with this hour that we are here together. Okay. So I'm always putting a butterfly on my slides because I want you to remember, hey, I'm here today listening to this. What am I going to change for the future? What impact is that going to have for me? Okay, so let's get to it. I'm trying to change. There it is. The agenda. So we're just, who am I? Just going to give you a little bit of why am I here talking to you about this right now? Our objectives for today. Why conflict in the workplace? Why is there conflict in the workplace? Where is this happening? And we're just going to kind of look at it a little bit more. Uh, Decipher, discover, explore the different patterns of conflict. I'm sure you already know that emotional intelligence is going to be part of it as a solution. And I'll talk a little bit about what psychological safety is. It's a new buzzword that we hear in workplaces now that's really important to consider when you're going to engage in conversation and find resolution. We're going to talk about scripts. I know that most people, when they're in a situation of a difficult conversation, they don't know what to say. That's the first thing people ask me is, what can I say? What am I going to say that's going to diffuse the situation or show my perspective or not insult the person, not be rude to the person as I want to say my point of view. So we'll talk about scripts in many different ways. And then just the takeaways for today. And then what's next for you? What are you going to do with this information? What's next for Differently with Soul, my company? And if we have any questions, we'll get down to it. Okay, so who am I? You know a little bit. If you're here, you know a little bit about me, but lots of experience. I worked in a lot of different settings. I have interacted with a lot of different people, and I've had many, many difficult conversations. I had the privilege of sharing an office with one of my colleagues. I will always remember Phoebe. Phoebe was brave. Phoebe is the type of SLP who will continue education and challenge herself. And she did a master's in ethics. in the clinical setting. So while she was doing some of her assignments and talking to me about the classes, I was enlightened by what she was learning ethically about conflicts, right? And I will always remember the class. She had an assignment in her class for negotiation and then another assignment in a class of mediation. I learned the difference. I applied the difference. She used it with her husband. I used it with my friends. It was crazy. But it changed the way I saw conversations and conflict, because conflict is just a point where we collide in terms of our perspective, but it's not personal. And so when she really gave me that perspective, and if you knew Phoebe and if you know Phoebe, you will know that she is cool and collected as a cucumber. She doesn't like cucumbers, that's funny, but cool and collected. And she goes into difficult conversation with no problem. She always knows what to say. So I learned a lot from her. I learned a lot from sharing an office with her and looking at her doing her assignments. And really, I'm all about, I'm really passionate about making sure that our workforce, the people working in speech therapy, have the tools to start their work and work with compassion, with ease and expertise. And today we're going to focus on the ease, because I don't want you to be uncomfortable with difficult conversation or conflict. And so I'm here for you to avoid any problems and to start your career on the right foot and know what to do when it happens. Okay, so the objectives really is because being able to manage conversation is one of the most important non-clinical skill. You don't learn it in school, but it's one of the most important ones that you'll have to master, develop, um, when you work in a setting. It's a life lesson. You know, you use it at work, you use the same technique with your kids, with your husband, with your friends, at the bank. It's the same. It's the same. So really, we're just going to highlight them a little bit more. We have to recognize that there's different types and that what it means. And there's different types because of you interact with different people. Really, emotional intelligence will really reduce the stress in these environments, and it would really highlight the miscommunication. And you're not attacking the person, you're not saying anything about the person. You're talking about, oh, we've had a miscommunication, and we're both sharing the burden of this interaction. Scripts. That's what everybody asks me all the time, what to say, what to write in an email. We're going to look at a lot of scripts to see how can we answer and meet the person where they are. And we're going to shift from winning the argument to really finding a common ground, because the conflict comes when we're trying to win, but it's not about winning. That's what I really learned with Phoebe. It's not about winning. You're trying to win, it doesn't work. You have to find a common ground. So we're going to explore that more. Why does it matter that we talk about this? Because conflict it's very critical for growth. When you have a conflict with somebody, if you can take some depth and some detachment from the emotion, you learn something else about the person or about the situation and you grow from it. So conflict is very critical for growth, but it needs to be handled the right ways. And when handled well, it becomes progress. You can collaborate together in a very different way with a certain understanding of what happened in the past. And so you grow and this progress in your relationship with that person. So this is the mindset that I hope you get at the end of this this webinar. Okay, so why we're talking about this topic is because clinical skills are not enough for job satisfaction. They're not. You can be the best clinicians, seasoned clinicians can have a really poor job satisfaction if they have intense conversation with doctors or with family members. They don't know how to handle these conversations and these disagreements, right? You can be the best, have the best clinical skills, but if you can't manage those, it makes your whole work life experience really sad, right? So, and they will shape these type of interactions, shape the culture where you work. So if this tense all the time, the culture, the cultural dynamic at work is tense, and then you don't feel comfortable engaging with your colleagues. If it's open and vulnerable and collaborative, then you can relax. You can discuss any disagreement just to see that we have a different perspective, and then you can move on from it. So it's really tied to cultural dynamics in the workplace. And like I said, even skilled clinicians will struggle if they're tense with conversation. So we need to talk about this topic as much as our clinical skills. Why conversations become difficult? Why is it difficult? Where do we get to a point where like, oh, I don't like this. Why is that? Why is that annoying me all of a sudden? It's because and if most of my audience today are students, new clinician, curious clinicians, it's because we have imposter syndrome. A lot of times when somebody is confronting us with something. It could be our manager, it could be a caregiver, it could be the doctor, it could be a colleague. We feel like we don't know enough. We feel like we're not inadequate to answer this question. And so that's a huge, huge factor in not feeling great in the conversation and feeling the intensity. Sometimes the other person doesn't see it. You're the one who feels it, right? Strong emotions, like if you're talking to a patient or a family member about disappointing results in a test, they can come back with strong emotion that really your body reacts to, but you want to respond without reacting, but you react. And so now all of a sudden you don't know what to say. So those emotions can be a problem. Power dynamics. There's a perceived hierarchy, unfortunately, in a healthcare system, sometimes in an education system too. And we feel like there's people in power, and then we talk to people in power, we don't have something to say, or we are not speaking to their level. I see there's a perceive because everybody has a specialty. Everybody comes for a team. And so really it's a perceived hierarchy, but there's no hierarchy. There should not be a hierarchy, right? Miscommunication. The first person did not, not the person, you and the other person in your interaction, something went wrong, and then everybody came back with different assumptions. Miscommunication, we have to share the burden. Something went wrong at some point. Different professional priorities and perspective, that's a huge one. The doctor talking about a patient has a completely different perspective than an SLP, a CDA, a SLIPA talking about the patient. We're all about communication, swallowing, quality of life. You know, we want them to have a voice wherever they are. We want them to be able to eat and find any ways to eat. The doctor may be talking about discharge, and that's all that matters. So it's hard. We have to appreciate each other's perspective to understand where the conflict comes from. Another one is not feeling heard or valued. You could be in a meeting or in rounds and you've said your point, and then people continue to talk as if you didn't add to the conversation. Or this is a big one because when you don't feel heard, it's just like you just crumble inside. So if that's the case, that becomes a conflict or a difficult conversation norm. A reason not to want to go to rounds and a reason not to speak in the future. So those are the things that we have to think about. So we know why it happens. I just want to highlight why it happens and if you can recognize yourself in these situations. The psychologists have generated different types. I've identified 5 types of patterns of the conflict styles. And those are probably what we go through when we have a disagreement or it's tense or it's difficult. So either we avoid, so something happens, we avoid completely to say anything, we just leave. So, okay, you're going to have peace, but there's resentment that builds after that. So this is not the best way to look at that. Accommodating, so you know you want harmony. It's like okay, let's just do this. Okay, fine, we'll do your way, but really you neglect yourself. You neglect what you could contribute, what you can contribute to this conversation. Competing, so you go and you exactly say, okay, this is what we're going to do, and that's it. Nobody else can talk. People are not going to trust you at the end. They're not going to feel heard. Now, the other person is not going to feel heard and not going to feel like you're contributing with the rest of the team. Compromising, this is when you give up something. I had to look at the definition of compromising and collaborating to really understand. But compromising, it could be fair, but it's like everybody gives up something. And then eventually it's not a solution because nobody's happy with this compromise. So both sides leave unsatisfied, right? Collaborating is the one we should thrive to do. This is the one we should aspire to do. And collaborating, it's the most time consuming. but it's the healthiest long term. So it's really taking the time to hear each other's perspective, to listen actively what to the other perspective, to detach ourselves from the emotions, to talk about the emotions that are at stake right now to diffuse the situation, and then together to come to a mutual understanding, a solution that both people are happy with. And that is what takes time. That's the mediation that my friend Phoebe was talking about. That takes time. That is the problem, right? So, what style are you? Do you recognize yourself in these types of patterns? And do you find that you do a different patterns depending on who you're talking to, or depending on the situation and the setting where you are at home or at work or the movie theater or when you're returning something? So, which one are you using? And really, uh, what I understand is that it depends on your cultural perspective as well. It depends on your background. The therapists are saying that conflict styles are often a survival strategy that you learn in your childhood. It's the way your family deals with this, it's the way you saw a way to resolve a conflict so you have peace. It's what you grew up with. Okay. And so, but they say that in adulthood, we need to update this to not just protection, but connection. So if it was a survival strategy as a child to protect yourself, to protect not feeling great, in adulthood, we need to use it for connection. A conflict is a connection. It's just a difference of opinion, but it's an opportunity to connect with somebody. It's really hard to see. So really, it's not about winning. It's about understanding. It's about understanding the other person's perspective. For me, whenever I have a conflict, I pause, I detach myself. I ask them for their perspective. I listen to the perspective. I reiterate the perspective. And then I say, okay, we have to find a solution because this is our common goal. And then we try to go above that. So why conflict isn't bad? I'm just going to reiterate that again. It's not bad because it's perspectives colliding. It's not enemies colliding, right? It's so easy. And it's like a point of connection when you disagree with somebody about a movie. You're like, oh, no, this movie was bad. Oh, what do you mean it was bad? It was great. Oh, no, I hate tomatoes. What are you talking about? Tomatoes are the best thing on earth. And then we laugh about it and we keep going. And sometimes it's funny to find out the things that we disagree on. So it's light, it doesn't come to your core, but it's connection. So why is it different in the workplace? Because it comes with your pride, your imposter syndrome, your how you identify yourself as a member of the team, and how you express yourself in a high stake situation. And really, the big thing that we need to look at is that growth comes from tension. It's like we need tension for something to happen. And so to trigger a change. And often on the other side of the conflict, a change happens, right? Just gonna check out the time, make sure we're good for time. We're good for time. Yeah. So again, see conflict as connection. I'm just trying to change the narrative now. We talked about what conflict is and why, and what the therapists are saying about it. And now it's time to say, okay, let's just change the script a bit and let's reframe what it means for us. And really, disagreement it doesn't mean disconnection. It just means that we have different perspective. Conflict can deepen understanding and collaboration. So it's going beyond the conflict. What does that mean? How can we find a common ground, right? And reframe. So difficult conversations are opportunities to connect and opportunities to gain knowledge. Sometimes you gain knowledge about how the other person works, their value system, what they bring to their work. Sometimes you gain knowledge about clinical skills that you didn't know about, what's important to consider, and that you didn't value or you weren't aware of something. So we need to stay vulnerable to be able to accept that, oh my God, this miscommunication, I learned something. It's not actually my idea that's the best one, it's actually theirs. So you gotta reframe that it's a bad thing. It's actually, hey, what am I gonna learn from this? Okay, so it's all about what I've been talking about for the last two slides. It's about emotional intelligence and psychological safety. If you work in education, I think emotional intelligence now is something that people know about. We know that it's about regulating your emotions when you're in a difficult situation. It's about your awareness and detach yourself from what's going on to be able to address what's at stake, what's really the challenge, what's really the issue. So it's to not to bring all your emotions at the surface. It's just to be okay. Let's just calm down for a second. What happened here? Let's find something. Let's solve this problem. So it comes from you. It's something that you can work on. It's something that you can be aware of, and it's something that you can bring to the situation, right? Psychological safety. Psychological safety is a term I've talked about it in the past many times. Psychological safety is a term that's now being used more and more in workplaces. It's linked to being comfortable in any place, to be able to be yourself in any place, and really is to be able to speak without fear. It's often dependent on the environment. Sometimes your managers create that environment, your coworkers collectively create that type of environment, or the workplace has things in place to create an environment um, um, with no fear. So sometimes the manager will say, "Come to talk to me anytime," or a colleague will say, "Whenever you feel stressed, just come to me. We'll just figure it out together." And so it often comes from the environment, but it's really important to realize if you have that where you are, if you have the opportunity, if it's there already, because then it's going to make things even easier to bring up, right? It's going to be easier to bring things up. But psychological safety is a big thing. Sometimes you want to talk about it, but you're in a place like, oh no, they're not going to receive what I have to say. And this is something where sometimes I mean, having talked about it today, you understand that there's why we get into conflict. You understand all the different patterns that we can react, and you understand now what to bring to be able to resolve the conflict. So you're coming with all these tools, and the next time you have a conflict, but the other person you have a conflict with has no clue about this, is trying to win, is not trying to find a common ground, is not trying to detach from emotions. So now you're like, oh, so obviously you see that in that situation, there's no psychological safety. It's not easy to talk. You can bring it though. You can make it, you can create it, you can change the mood a bit, but it's something to be aware of. You can have all the emotional intelligence you have, but psychological safety is hard if it's not there. So this is where vulnerability is a big factor. If you're willing, no matter what happens, to be vulnerable and to be able to talk about the problem openly, you could be the one fostering psychological safety in your workplace modeling it by modeling it. This is, guys, I'm talking life lessons here. Like, this is beyond the workplace, but everything's at stake in the workplace. You spend so much time there, and if you don't feel comfortable there, it's a huge, 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 huge issue. And so, like I said, I mean, your rules of engagement may differ. You may come in ready to solve this collaboratively, and the person is like, I don't know what you're talking about. My idea is what we're going to do. So, vulnerability, talk about the psychological safety, keep pushing emotional intelligence are things that we can do. So, Zen in the middle of chaos is possible, but we need to be vulnerable and we need to have courage to be vulnerable. We need to have courage to be able to do it. And you're going to see how it's going to help create a stronger workplace and a stronger work culture. So let's talk scripts. Let's continue this conversation. Let's see what we have for time. Yes, let's continue this conversation with scripts, because that's what people want to know at the end of the day. So again, I just want to reiterate that when you're in a conflict, the most important things you have to do is to detach yourself from the emotion, to understand the other person perspective, understand that nobody is inherently bad. Nobody wants to do bad. Everybody wants to do good. But your good is not the same good as yours. But at the end of the day, everybody wants to do their job at some point. Some people want to do it well, some people want to do it fast. Some people it's about quality, some people it's about quantity. But everybody wants to do something well at the workplace. We just don't have the same what well is or what good is. So we have to assume that everybody comes with that understanding. So your role is to understand, ask for their perspective, show them that you want to hear that perspective, because often people cannot do not feel heard. Then practice active listening to really look between the lines and understand what are they talking about. And then you got to stay open and vulnerable to say, wow, I did not know that I need to take this on going forward. Or, okay, I see why we have a disagreement. And how can you invite them to hear your side and to try to have a common ground? So I think those are the biggest thing that we have to do in a moment. So let's just get into scripts for a second. So the next few slides is about having conflict with different types of people at the workplace. So for example, conflict with your peers. Um, we interact a lot with each other. CDAs, SLIPAs, SLPs, students, all of us. We're in the same, we're all in the field of speech therapy, but we can have very different ideas just because of our work experience or life experience and value system, or difference in experience level. And so this applies to everybody. And I want you to feel as a student the opportunity to also go to your clinical educator to be able to talk about it if you feel that there's a conflict that's going to show a lot of maturity. And I think it's going to be great for your relationship going forward. You can both grow from knowing that you can bring up difficult conversation and difficult information and continue. This is something to be really aware of when you do your evaluations for students. You really have to be aware of how you feel when somebody's giving you an evaluation, because then you can apply all that I just said, right? Difficult conversation. Um, and so difference in assessments, findings, or treatment direction. So example, two SLPs debating therapy focus therapy focus for post-stroke clients. So script is like, okay, I see your reasoning, but can you walk me through it again so I really see your point of view? I really understand where you're coming from. You don't have to share. Sometimes you won't have the opportunity to share yours, but your goal is to understand how she came to that solution. So as soon as you see a disagreement, focus right away on making them explain their reasoning, so to understand where they're coming from. Maybe it's something you missed, or maybe there's something you want to add to this conversation. And sometimes if after you hear this, you're like, okay, that's very interesting. I never saw it this way. Or you could be, oh, I see your perspective now. I see where you come from. Now, can I share where I'm coming from? And then you realize that you're coming from two different points, but probably for the same common goal to help the patient, right? Another group of people that you can have conflict with are your colleagues, OTs, PTs, nurses, anybody that can work with you on the unit. It could be teachers. I'm sorry, I sometimes forget that we work in education. It could be teachers, it could be special ed teachers, it could be principals, right? And so we're making you hear other it happens a lot when you see people having a lot of experience working together. They can make comments outside of their scope, and you hear them making comments about swallowing or communication or an AC device, and you just get tense because like they shouldn't talk about it. It's my world. It's my role. So what can you do? Um, you're going to say, I appreciate your input, but can I clarify what SLP scope covers here? Can I just clarify what's going on from my perspective? But I appreciate that we've worked so well together that you're almost speaking what I would say, or you see some aspect of my job. So just to recognize why you think they're saying this. And if you don't know why, you ask why. Still, so how did you see this? How did you see that? How help me understand how you see that the swallowing assessment is not going to work. Oh, so what else did I miss? Did there something else that we should have talked about? So come with curiosity more than judgment. That's the word I was looking for. Curiosity. It's about learning the other person's perspective all the time, and then diffuses the conversation, diffuses the situation. Another type of people that we can have conflicts with are our managers. Happens many times, as you know. And so here, let's say they want you to do more, They want you to increase your caseload. You say, okay, I understand that efficiency can be important, but I want to explore how we can make sure that quality is also preserved. Do you want to come down with examples with me? How do you see that we can add it to the increasing in the productivity? So I really want, I feel in my experience that always listening to the other person's perspective is important. The manager is quality, it's quantity. They always look at productivity. That's their job, to make sure that the staff is productive and happy. They shouldn't make sure that we're happy, but it's all about production. It's all about productivity and making things run and discharges and making sure that we can see more people so we fulfill the funding and all this. And so that's their job. We cannot fault them for pushing that agenda. But what we have to do is raise the awareness, let them know what our agenda is and how we can find a mutual solution. Sometimes they don't know that we don't think the way they do, and we have to find a common ground. And so it's like I say, it's really about finding the other person's perspective, knowing that they're not inherently bad, that they have a different perspective because they have a different job than us. And then once we are aware of theirs and then we make them aware of ours, then we can have a real conversation if they're open to it. Hopefully they are. Hopefully they are in an environment of psychological safety. Hopefully they are also adopting strategies from emotional intelligence, and then you can carry on. Patients and caregivers, sometimes when we give results. So sometimes when we give sometimes patients or caregivers disagree with our swallowing recommendations. They don't think they have any problems. They think everything's fine, or they think it's too much, it's overboard. Um, Sometimes it's just because they have health literacy gaps. It's really important in this group of people that we always educate in terms of what's possible and what's not possible. So I find with patients and caregivers, it's often understanding what healthcare can do. Like I cannot make you not silently aspirate. I cannot, do some, like I have strategies to help you reduce that, or maybe exercises if you know you have cancer or a stroke. But there's some things that are possible and some that are impossible. So sometimes they just, when they disagree, it's often, not always, but often because they need more information and education. Often it's because they are focusing on their quality of life and we're focusing on quantity of life. We're risk adverse for them, whereas for them it's all about, am I having fun with this? Is it going to be, or will I be able to do this at home? Is that going to change my life to try to do this? So I think it's something, I think I put two scripts here because I think we can address two things. So I hear this feels very restrictive. My goal is to keep you safe at mealtimes. So we share your goal with them. And I think I missed something. Tell me again, what's bothering you? Let me understand your point of view or how this information lands on you. Like let them talk to say that I don't want to disagree. Like we don't want them to not agree with our recommendations. Our job is to give them the recommendations, but we need to understand how it lands on them to see if we need to say it in a different way, or then if we need to have a different conversation about the recommendations and their safety. But I think when a disagreement, sometimes we haven't heard them properly, or we didn't um, appreciate their perspective and their goal in this conversation. Because sometimes, we come and give recommendations, but for them, the patient and the caregiver came to the hospital to get solutions, to get back like before. And we're telling them, you need to do this to get back like before. So it's just like, sometimes it's just explaining what the process is. So I'm just saying it works sometimes and sometimes it doesn't work. But they should try to go through those steps to at least come as much as possible towards a mutual agreement and understanding with respect, and then see what happens after that. Looking at the time, make sure we're okay. So caregivers is a bit the same thing. When family resist discharge, they don't want to go or they request more therapy. It's often a lack of knowledge about the healthcare system that I've experienced many, many, many times. I'm at the moment I work in acute care and sometimes people request therapy. I have to explain that the staffing that we have is not for therapy. The staffing is to make people safe and stable. And once they are, we have to make sure that they can move to an area where they can get more therapy. But the healthcare system is such that you wait. You wait for a bed to be available, or you wait for funding to be available. Depending on where you are in the world, it could be a bit different. But know your healthcare system to explain it to the caregivers and the patients so they understand how things work, right? So sometimes I feel like they just need more information, or we need to understand where they're coming from and their frustration. So the script could be like, I hear your concerns, I hear you. You can repeat them as well because people just want to feel heard. But let's review your progress together. Let's see where you're at so far. And I feel like sometimes counseling is a big one that helps to um, mitigate escalation of problems just by hearing them and providing them some education about where they are in the healthcare system or the educational system if you work in a school and understand how it works to go from one place to the other and understanding wait lists or funding, right? So sometimes another example, and I don't really have a good script with it here. I feel like I didn't finish my thought process here, but when parents are insisting on continuing therapy when child is plateauing, that happens a lot. And actually, you can still say, I hear your concerns, but let's review the progress together and let's see what else you can do in the meantime. And what does that mean? Because especially for parents, they come to us to fix their kids, to make them as if there's no problem. And then we're saying that they plateau. It's not a concept that's going to resonate for them. They're looking at the child's whole life. So I can see how this is very emotional driven, and we have to address that a little bit. And maybe there's counseling that needs to come in it. Oh, the doctors. I pause because there's a perceived hierarchy. I say that with a lot of I missed the word, but it's perceived hierarchy. We all have our specialty, but the system is such that they have the final word. They are the ones driving the decisions in the healthcare system, and so even also in the educational system when it comes to pediatrician and psychologists and neurologists. Um, but we all have, it's really hard sometimes when they have a different view, an overall view, different than your specific expertise, and to let them see it and understand them. So sometimes I'm not trying to manipulate the situation, but for me to understand where they're coming from, I will ask them, what? What is your goal here for this client or patient or kid? What is your goal? What do you see? And then I say, are you open to hearing my perspective from an SLP or from a swallowing of a communication? Because I think there's something else that we should need to keep in mind. Um, I always try to make them reiterate their perspective because unfortunately, in my experience, um, in our reports, we have to give so many justifications for different things and they don't have to. And so sometimes we miss why they said that. In their education, they every decision has weight, but sometimes we don't have the opportunity to hear how they come to this conclusion. So sometimes that's the first thing I ask. I said, help me understand how you come to this conclusion. And then can I add to it? Do you want to hear my perspective? Can you consider the SLP perspective in this picture? Not always easy. It's the group that I have the most difficulty with, I have to say. But what I learn when I'm able to get there, when I learn from their perspective, when I learn and able to gain or increase my knowledge in the healthcare system is so valuable. I have to stay very vulnerable and very humble as I hear them speak. Sometimes I'm like, I never saw this perspective. I never thought that this was a bigger impact than this. Or, okay, I want to contribute to this care. We're a team here and I have a specialty that I want to share with you. So I feel like because of the perceived hierarchy and the way the system is set up, we have to work a little bit harder. But then once you get that relationship with that doctor and they see your perspective and they see that you're always trying to understand where they're coming from, you develop a really nice working relationship with that person. You develop now mutual respect for how you're coming into conversation, and they can also see that it's a difference in perspective and difference in specialization and goals. So hopefully you can appreciate that eventually it changes the relationship that you have when you always have the same conversation with the same person. Let's move on. So basically, those are the different types of people, the different types of scripts I wanted to talk about. Other examples of conflict that can happen where you can still apply the same type of scripts. You know, in hospitals, it's like new grad intimidated by a physician pushback. In schools, it's like a teacher disagrees with an SLP recommendation for AC. In community, a caregiver resists homework or setting that they don't have time. In private practice, the parent expects rapid results despite the diagnosis. All these areas, same thing. You want to stop, you want to ask for their perspective, ask a few times why to understand um, what's bothering them in what we're saying. Then you see what their goal of what they came to you for, what the goal of their interaction or their role is for the client. And then you offer your goal and see how, in some ways, they're aligned or not aligned. And then you have to try to find how to collaborate together, right? Not compromise, not give up something, but really find a mutual solution. And remember that you come in with with the intention of doing that, but they may not. So it's where vulnerability and courage are going to be important to see if you can get there, right? I'm giving you more phrases because people always ask for scripts so it comes quickly in the moment, right? One that I may not have. Oh yes, I did put it here. Okay, because you want to respond in the moment, and sometimes you want to delay the response. So there's a couple of things you can say. So I understand how you feel. Let's find a solution together. Can you help me understand your perspective? I appreciate your input. It's okay to disagree. Let's focus on what we can control. That's a good point. I will get back to you on that. So that's if there's something that you don't know how to answer, but you know there's something. You don't want to leave the person knowing that this is it. You just gonna say, hey, that's a good point. I will get back to you on that. I often tell students if they're in an environment where they're not with their clinical educator, let's say they're in rounds and the clinical educator is not there, and now the team have seen them for a couple of days, know their student, and then they start asking them questions that they can't answer. I always tell them this is what you say with anything they tell you, and then we can talk about it later. That's a good point. I'll get back to you on that. That's it. You just say that you heard them, but there's more to it. And then get back to you. You can go talk to them once you have more information, feel more confident, and being able to do it in private if that's something that's better. Oh, so what you said is blah, blah, blah. I hear you. Can I share my perspective now? So people always want to feel heard. People like when you have a disagreement and you're saying your perspective and the person doesn't get it, you keep saying it and the person doesn't get it, and then you get frustrated and you keep saying it and the person doesn't get it, and they're trying to see their perspective. It's because we don't take the time to hear each other. We don't have to agree, but we have to make sure that the person knows that we understood. So I think that's a big one. And then make sure that we understood their perspective. So that's why it keeps coming back here. It keeps coming back in here. I put something really quickly. I really like the way this person, Johnny Twos, describes and talks about how each feeling, what it means to say a script. And so what you're addressing. And I really liked how it said that and how um, you're showing empathy for the person that you're talking to. Um, I understand how you feel. So you're acknowledging the feelings. Feelings can create connection and ease the tension. Let's find a solution together. You're promoting collaboration and encourage teamwork. Can you help me understand your perspective? You invite others to share their point of view, fosters empathy. I appreciate your input, valuing others, opinion builds trust and respect, so on and so forth. So it's okay to disagree. So you're normalizing that disagreement can lead to an open dialogue. It doesn't have to be bad. How can I assist you right now? Offering help shows support and commitment. Let's take a step back. So that's a bit of the detachment. Pausing allows everyone to gather their thoughts. What do you suggest we do next? Encouraging suggestions empowers others to contribute. That's a good one, actually. I have to remember this one a little bit more often. Sometimes I give them the power to decide what to do. And when I do that, it opens up the floor a lot more. I hear what you're saying. Reflecting back shows active listening and validation. It's a challenging moment for all of us, and normalizing feelings, and it can unite teams during hardship. Let's focus on what we can control. Redirect attention can alleviate stress, and I'm here to support you. So reassuring others can encourage resilience. So I really like the way he framed it. So that's why I wanted to give him credit and put it here for us to review and to think about when we are talking with, when we are interacting or participating in difficult conversation. More scripts, more scripts. I wanted to make sure that you leave this session with scripts and ways to address the situation. So I respect your role. May I share another angle when you talk to the doctor? The patient, I hear your fear. Here's what we can control. Here's what we can do about it. Manager, what's your shared goal here? What do you want us to work on together? What do you see that we can work on together? And a peer, can you explain your thinking again so I can compare it with mine? I love these scripts. I must tell you that when I do webinars, what I like about webinars, I share my opinion, but it elevates my learning because I want to find a validation for what I want to share with you. So I go beyond what I know to make sure that I'm giving you valuable information. So this one, I must say that I researched a little bit more, and I was so happy to find those scripts. So I've not used them in this way myself, but I recognize I've used words similar. But again, I'm just really bombarding you with different examples of scripts so you understand how to tackle a situation in the workplace. Sometimes you need to go beyond that. Sometimes talking back to the person and trying to do it yourself doesn't work. And so, especially if you feel that it escalates, that's beyond your control. Now, people are no longer interacting in a respectful way, or maybe you need to disseminate the conversation, like de-escalate and stop. If legal or ethical issues arise, if it's about a patient and now you're like, oh, we're disagreeing, but I'm really concerned about the safety here of the person and the point of view. Like now you ask for maybe an ethic consult and discuss from that perspective. If it's starting to affect the team dynamics, and it's repeating, maybe it's time to look at it in a bigger way. And balance independence with timely escalation. Oh, that's a tough one too. If you see that you're really trying to do it yourself, but it takes time. It's gonna take more time to um, de-escalate the situation. You may ask for some help. Uh, if it's taking too much time and now it's beyond you, I think it's good to ask for help. Managers can help. There's people in HR that can help. There's always in most workplace a person's whereas their job is to help with these type of situations. So for you, I just want you to think quickly after hearing all this. Think of your last conflict at the workplace. Did you listen? Did you validate? Did you find a common ground? And what do you think you're going to do next time? What is the one thing that we talked about today that you're like, oh yeah, I got to do this more. I got to do this a little bit more. I don't do it often. So it's something that I'm encouraging you to look at. Bottom line, why are we here? No one is out there to get you. No one is out there to get you. People are inherently good and want to do good. Conflict is inevitable, but manageable. Emotional intelligence is your best tool. Use scripts and active listening to reduce tension, and growth comes from connection, not winning arguments. I think that sums it up. I hope that this was a valuable um, 30 minutes of, I don't know, 40 minutes, 50 minutes that we've done together, just to really understand that we can detach ourselves from the situation that's at hand when emotions are high and it's starting to be tense. I hope you can appreciate now that there's different levels, there's why it's happening and how the pattern and the style that you're adopting may not help the situation and what you can do about it. That's really the bottom line. What's next for you? What are you going to do next? It's kind of like the mini reflection. Are you going to try a new script this week? Are you going to reflect on are you going to reflect on your default conflict style? Are you going to see what am I always doing in a conflict? Am I avoiding? Am I competing? Am I compromising? Um, are you always asking what's your shared goal with that person, the person you're talking to, and how you're going to try to find the common solutions? Um, the butterfly is back. I really want to reiterate that we are here to learn some tips that can help us at some point in our career or can have a huge impact of how we work with others. If you're in a speech therapy world, you know you're working with people. We're not working with computers here. We are always interacting with people, and it's important for our job. And so know that what we talked about today hopefully helps you understand how to connect with your peers in your workplace. So I always put the butterfly here to understand that this was only an hour, but hopefully it has an impact in your work life or your personal life. I'm sure. I hope it does too. Oh, so I am so I've been so fortunate to be able to provide and to host this webinar this summer. We started with a lot of different topics and we ended with a really big one. And I shared a lot with my audience. I learned a lot with my audience. Every time, as I said, when I do those talks, I learn more. I elevate my learning because I validate it with more things, and I really want to make sure I'm giving you some valuable information. So then I learn even more, which I'm always happy about. Um, and yeah, so to continue our conversations, to continue to see what's next and differently with soul, sign up to the newsletter. Go on our website and sign up for the newsletter. There's more information I want to share with you to help you practice with compassion, ease, and expertise. There's no reason to struggle. There's no reason to struggle. So many people have paved the way for you today. There's no reason to struggle. You have a community. I want to be part of this community. So hopefully that resonates with you. And I like this quote. I had to put it. The butterfly is still here. But change does not happen by chance. It happens by design. So if you want something to change in your life, you got to do something different. And the different is what you can design. And from the tools that you learned today, there's a lot that you can do to be able to change conflicts in the workplace and difficult conversation, or how you come into these uh, situations. I hope that you were able to get a little bit out of it. And that's all I had to say today. I'm so happy that you were part of this conversation, and I want to continue speaking with you on Instagram, on LinkedIn, on the website with the newsletter. Please, please, let's just connect because I have so much more that I want to share. I do webinars every summer. I've did it last summer in 2024. I did it this summer in 2025 because there's a lot that I can share. This is how I can connect with my peers and elevate the world of speech therapy so we can all work with compassion, ease, and expertise. Like it's such a beautiful job, and I don't want us to struggle doing it. I want us to change the world, right? So I will stop the share for a second. I'll stop the share for a second and I'll ask if there's anybody who has questions, comments. You can put it in a Q&A. I'll check it out here and or in the chat. I'm happy to connect either or in either places. I think it's really important that we, as clinicians, whether you are a student, whether you are a new grad, a curious clinician, or a seasoned clinician, we can learn from each other all the time. I think as SLPAs, I think as CDAs, I think as SLPs, I think we also need to continue our conversation and connect so we can really learn to work better together. We have a common goal with different value system, but also different expertise. So I think we need to have more opportunities for people to exchange the way we work together. And I'm one of my passions is always to connect with students. One of my passion is to be able to help students feel comfortable in the field and to come in the field with a passion. I stumble a lot and I had a really humbling beginnings. I did not like my job at the beginning. I will say it here, horrible clinical educators that were not there for me. I felt like a nuisance to them. And all I did was trying to please them the whole placement or internship. So I knew that when I became myself a clinical educator, that nobody will feel like that about me. And I will definitely help the person feel comfortable in the field. And so that is a passion that I do with all my heart. And I really want to continue to support people. And that's why I created Differently with Soul, because I do it differently and I can do it my way. And from the clients that I work with and the students that I connect with, I know that something changes for their lives and things are better after they met me. And so I encourage you to continue to engage with my content and ask questions. I'm so happy to hear how you're living speech therapy, how you're living in the field of speech therapy. Um, and so I hope that we can connect soon, making sure that all the people in speech therapy around the world, whoever in whatever capacity you're practicing, feels comfortable, feels that they're bringing value to this world. And so I wish you all the best and have a good day.